Virginia Henderson, Nursing Need Theory. Virginia Avenel Henderson was born in Kansas City, Missouri in 1897. Her nursing career began when she enlisted in the Army School of Nursing in Washington, D.C., and took classes at Teachers College at Columbia University. After graduating from Columbia in 1921, Virginia Henderson worked as a nurse at the Henry Street Settlement in New York City. This is a short video of Virginia Henderson defining nursing from YouTube.
I tried to do for them what they would do for themselves if they had the strength, the will, and the knowledge that a nurse has. And I try to do it in such a way that I don't make them dependent on me any more than is necessary, so that I can give back that activity, whatever I'm doing. I try to make myself, I don't try to make myself indispensable. I try to make myself dispensable at the earliest possible time. Do for others what they do for themselves. They have the strength, the will, and the knowledge. But to make them independent of help at the earliest possible time. But now that's not all I say, and that's what troubles me about the way people quote my definition. They stop there. And I go on to say, and I say this much more emphatically every time I say it, because I think this is what nurses have got to realize and what the public has got to realize. That the nurse also diagnoses and treats. If she is the person available to that person who needs that help, if there's no doctor available, she invades this holy of holies, the practice of medicine, which I think is foolish for them to think they practice alone. They don't.
Virginia Henderson was the first nurse educator at the Norfolk Protestant Hospital in Virginia. She later began her career in research at Yale School of Nursing as a research associate in 1953. Although Henderson worked on numerous textbooks, her most important project was the Principles and Practice of Nursing, which was published in 1978. Virginia Henderson was passionate about travel, writing, and the right to health care. She believed that everyone deserved universal, comprehensive health care and that patients should participate in their care and be responsible for their own health records. Do you share any of Virginia Henderson's passions? Virginia Henderson's theory of nursing need surfaced in the 1930s and evolved well into the 1960s, which was an era of reform and development in the U.S. Around the time her theory evolved, World War II and the Korean War heavily influenced the need for more women to begin working, prompting more traction in women's rights. Additionally, the civil rights movement was gaining momentum. More standardized educational opportunities were being offered for different genders and races. In the 1960s, the U.S. Public Health Service reorganized, and in 1966, Medicare and Medicaid legislation was created. Henderson remarks that Thorndike's Fundamentals of Man influence her nursing theory, as patients' basic needs must be cared for before they can gain independence in their own care. Henderson's theory is based on holistic care rather than a medical diagnosis. The components that influenced their well-being included biology, psychology, sociology, and spirituality. As healthcare underwent reform, Henderson felt a need for patients to become more involved with their own care. Henderson's theory is based on 14 patient needs: breathing normally, eating and drinking properly, eliminating organic waste, moving and maintaining a desirable posture, sleeping and resting, dressing and undressing, maintaining body temperature at normal level, keeping the body clean and protecting the skin, avoiding environmental risks, communicating, learning, practicing according with their faith, providing sense of accomplishment, and participating in recreational activities. A quote by McEwen and Willis, 2019, supports that the listed concepts defined in Henderson's theory. The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to a peaceful death, and that he would perform unaided if he had the necessary strength, will, or knowledge. and to do this in such a way as to help him gain independence as rapidly as possible. Henderson's theory emphasizes the importance of promoting independence among sick patients. Nurses can also use this theory when collaborating with the interdisciplinary healthcare team to advocate for ways to improve patient autonomy. Henderson's theory is utilized in other research, including a study by Saul et al. In 2018, identifying a correlation with education for patients with Parkinson's to decrease falls, increase mobility, and increase independence. This is an example of providing patients with strength, will, or knowledge. The flowchart above depicts Henderson's need theory, emphasizing that nursing is defined as the assisting of an individual, regardless of them being sick or well. Henderson's need theory has never been formally tested. However, the theory supported other theorists' research work. Lopez et al. From 2018 used Henderson's model to outline the relationship between pressure ulcer risk based on Norton scale in the eating and drinking need assessment. Patients with lower Norton scales had poor nutrition, putting them at higher risk for pressure ulcers. Henderson's theory is simple yet complex. The 14 activities for assistance are clearly identified, but the evaluation the nurse must complete can be difficult. Henderson's nursing research has had a positive impact internationally and has been identified as credible, aligning with other research. Adequate knowledge and effective communication skills ensure excellent patient care. Her principles on the nurse's role are to ensure patient health needs are met. Peplau's interpersonal relations theory stated, nurse-patient relationship is the primary human contact that is central in a fundamental way to providing nursing care. Peplau's theory of interpersonal relationships was inspired by Henderson's nursing need theory. Peplau's main concepts identified 4 phases that are vital in guiding the nurse-patient relationship. The phases include orientation, identification, exploitation, and resolution. The 4 phases relate to Henderson's need theory through interpersonal processes that occur between the nurse and patient, which involves Henderson's 14 activities focusing on the nurse assisting the patient toward independence. For the case study, a 70-year-old man is in the emergency department. The patient has stage 4 chronic kidney disease, which has worsened over the past 3 years. He also suffers from mixed vascular and diabetic neuropathy, secondary anemia, hypertension, type 2 diabetes, AFib, lower limb peripheral artery disease, and an amputation of the right big toe. The patient presents with anxiety about his health and moves with difficulty due to pain. He does not sleep well and has poor hygiene due to lack of mobility. The goal of care is to manage the patient and prevent a DVT. The patient was evaluated in terms of the 14 basic needs, according to the conceptual model of Virginia Henderson, in order to develop and apply the individualized care process. The listed dependency needs were reported from Truca et al. In 2016 as requiring improvement for the patient. The nursing staff determined that the following needs could be met independently without intervention. The patient was discharged home with decreased complications and a shorter hospitalization time after thorough education. The patient's quality of life notably increased thereafter, visibly improving his social and emotional status with good physical and mental development. Can you remember a time when you used the components of Henderson's need theory to care for a patient? APRNs can implement the use of this theory to help promote independence in their patients by addressing concerns early on within the outpatient setting. By promoting family and interdisciplinary communication, APRNs can create care plans in an inpatient setting to decrease the length of stay and improve patient outcomes. Thank you for listening to our presentation.